and invite Professor Quinlivan again. Sorry for wearing you a little bit out, having you to
Okay.
speak twice today.
Thank
But
you.
thank you so much also to go with us through what you should be alert of as a patient and what is important. What is important to know. Um, I know that it's not specific case studies as patient, but you decided to do a little bit more generic issue. So thank you so much. Thank you.
Thanks very much, Elizabeth. And it was so good to hear those previous speakers really going into quite a lot of detail about care for adults with Duchenne. So this is going to be very much an anecdotal walk through some of the situations that we've come across. So a very generic talk so that we don't identify individuals. And so what I'm focusing on really is for you as adult men is what can you do to be healthy? And I know it sounds silly, but it actually being social is really important. So often I see men with Duchenne who, when they leave school or leave college, just retreat to their bedrooms. I think it's, try and maintain a social life. I think that's really, really important for your health. And secondly, don't be passive. Become an expert. Learn about your condition and be proactive about the care you need. As you've already heard today, Duchenne healthcare, particularly in the adult with Duchenne, is a complicated business. And in the adult field, many doctors that you come across will have limited knowledge and experience. So you need to be experienced and knowledgeable yourself so that you can guide these doctors, because they will help you, but they need your help too. So know about your condition. I recommend you download the standards of care that we've been talking about. The Bernkrat ones that are present in the Lancet Neurology, and also our consensus standard of care for adults. And if you can, through your clinic, ask your clinic to create an emergency care plan for you. And I know this sounds silly, but if you have to go to hospital in an emergency, do remember to bring your ventilator with you. So often we hear that people turn in up at hospital in a crisis, they're not very well, and they've left their ventilator at home. Bring it with you. Bring any equipment that you use regularly with you in an emergency. The other thing, I mean, this sounds really obvious, doesn't it? Attend your appointments. We have so many failures to attend appointments. People are more worried about going to college or doing other things. They're too busy, which is a good thing, have busy lives, but then they don't attend our appointments. And these appointments are really important for you. As you've heard already today, it's all about being proactive and preventing complications from occurring. So the last thing I know you want to do when you feel really well is to come to the hospital, but actually it's really important. So if you need help to get you to clinic, get yourself help, try and plan it in advance. And I think the other thing is, even if you attend all your appointments, if you haven't heard from the hospital about an appointment, then be proactive and contact your team, because the hospital will be seeing hundreds of other patients. And sometimes, these are computer systems and people can fall through the net. So because you haven't heard anything doesn't mean it's all okay. So if you haven't heard anything, contact the hospital. And also let the hospital know how they should contact you if they need to get in touch with you. So often we call our patients and they don't pick up the phone, and that's because the hospital will always not have a number calling. So I think a lot of people think it's a cold call, but let the hospital know the best way to contact you. Sometimes I now contact my patients by text message when I want to ring them, and then they know it's me and they pick up the phone. Otherwise they don't pick up the phone because they think it's a cold call. So let them know how to contact you. It's also really important to keep a healthy lifestyle. I've seen patients or people with Duchenne when they go to college. I had one guy who gained something like 8 kilos in weight in 6 months because he went to college and just had a diet of burgers and chips. That's not good for anybody, whether you've got Duchenne or not. So a healthy diet to maintain a healthy weight is really important, and everything in moderation. Again, we have seen patients in our service who have got into trouble from drinking too much alcohol. When I mean too much in one sitting, and some people who drink too much on a regular basis, and it has had an adverse effect on the health. So I wouldn't say don't drink alcohol, but don't drink excessive amounts. And, with Duchenne, you're at risk of respiratory difficulties and needing to use a ventilator. So don't make your breathing worse by smoking or vaping. These, I know they're social, but they are not good in the long term for you. And likewise, cannabis. We've had 1 or 2 patients who've really got themselves into trouble smoking a lot of cannabis. Also, again, it's obvious, take your medication. Don't let your steroids run out. You heard from Dr. Wong the importance of taking steroid medication every day. If you're on it and have been on it for years, if you run out of medication, that could be a problem for you. And quite often, I often get an email on a Saturday night from somebody who's at uni saying, I've run out of my tablets. So really, get your repeat prescription before it runs out. We often find that anxiety can get in the way of taking medication. So again, a lot of the treatment that we give is to prevent complications from occurring. So people have to take drugs when they feel perfectly well, and that can be an issue for compliance. And we've certainly had situations where people have been worried about taking heart medications when they feel perfectly well. And then they've come back to us a year later and we've got a real problem with a decompensated heart and heart failure. So these medications are very important. Even if you feel well, take them. And we were talking about bone protection, and I know Dr. Wong was talking about bisphosphonates, but also vitamin D is really good for bones, whether you're on steroids or not. In my experience, most Duchenne men get very little sunlight. So taking a regular vitamin D supplement is really good to protect and strengthen your bones. Again, we've had some really serious issues. We've actually had some patients who've died from not using their BiPAP machine. I think the reasons for this are complicated. Sometimes people feel claustrophobic because of the mask on their face. If that's the case, please talk to your respiratory team, because there are different options that they could try. So instead of a full face mask, they can give you a smaller mask. So please contact the team. Sometimes what we found is during COVID, some people might have got into a habit. They might miss using it 1 or 2 nights and then think, oh, I feel fine, so I'm not going to use my machine because I haven't any symptoms. But one of the problems with respiratory failure is you don't get symptoms until it's really too late. So please, if you have a BiPAP machine and it's been recommended for you, please do use it. It's there to help you. I think it's also important to say that if you have Duchenne, as you've heard, it's a complicated condition. So if you don't feel right, if something doesn't feel right, don't be afraid to contact your team and ask for help and advice. The sort of things we see really commonly amongst our adult Duchenne patients are anxiety and depression. That's very, very common amongst Duchenne patients. Fatigue. This could be, we'll talk about it in a bit more detail in a moment. It could be a symptom of something minor, but it could also be a symptom of something more serious. Abdominal pain as well, limb pains, back pain. And sometimes if a cough and cold is getting worse, you need to ask for help urgently. So let's talk about anxiety, depression, and phobias. As I've said, these are very, very common amongst our adult Duchenne cohort. They could be a cause of insomnia. So again, if you're not sleeping, that's going to make you feel worse. Again, anxiety, depression can result in pain and fatigue. And these conditions are treatable. So don't shy away from the option of treatment, and talk to your team if you experience any of these symptoms, because otherwise they lead to unnecessary distress and they will affect your quality of life. But also, what we found more worryingly, they affect your ability to comply with the treatment that we offer you. And that in the longer term can be life-threatening. So actually, these are quite serious conditions that need to be taken seriously and treated. So let's look at fatigue. You know, fatigue and feeling non-specifically unwell can be a common symptom in adults with Duchenne. As I've said, it could be a symptom of depression or anxiety and insomnia, but it could be a symptom of something more sinister. Certainly, if you are not yet started on home ventilation, feeling generally tired could be a sign that you need some support with your breathing. And that's because, as you've heard earlier, if your breathing is weak, you're weak at nighttime, you'll retain carbon dioxide and you don't get a good night's sleep. So you feel very tired in the day. It's also can be a feature of malnutrition, as we've heard from Professor Emmanuel. That can be a problem in adults with Duchenne. And actually, it can be one of the only symptoms of heart failure. So heart failure in an adult with Duchenne doesn't present in the same way as heart failure in, for example, me or your parents or somebody else. And likewise, we found it's been a symptom of kidney failure as well. We've seen a number of our adults with Duchenne presenting with quite severe anemia. We've had to give infusions of iron, and one patient actually even needed a blood transfusion. So, and again, also type 2 diabetes. But all of these things can be picked up with a regular blood test. So we recommend doing the blood test at least once a year to keep an eye on the function of the kidneys and for anemia and diabetes. What about abdominal pain? Again, this is a common complaint, most commonly due to constipation. And you heard from Professor Emmanuel about how complex constipation is in the Duchenne population. Also due to bloating from the BiPAP. Sometimes it can be distension of the stomach, and venting from a PEG tube, if you have one, can be very useful. We've seen severe abdominal pain, mainly occurring around the loins, it's around the side or the back, radiating down to the groin due to kidney stones. And you remember I mentioned how important it is to drink plenty of fluids, because we've seen a lot of patients now with kidney stones who've needed surgical intervention. So if you can prevent them, that's far better. Remember that tummy abdominal pain might not be anything to do with your Duchenne dystrophy. Don't put everything down to the Duchenne. It could be appendicitis. I've had a patient in the past who had appendicitis, and we have a patient, I've seen 2 patients now with gallstones requiring surgery. But also related to the Duchenne, there can be acute gastric and abdominal emergencies. This is what we call here volvulus, where an area of the bowel becomes very distended. And we've seen that in about 3 patients now. We also see pseudo-obstruction, where the bowel just some small area of the bowel muscle doesn't work very well, can be caused by constipation, and also ileus, where the bowel just stops working for a period of time. So all of these are potentially life-threatening. So if you have a distended abdomen, if you see what we call peristalsis, you see the movements of the bowel through the abdominal wall. If you're vomiting, any of those things, and if you also have severe abdominal pain, this is a medical emergency and you should go and seek help. The other thing to mention is that people who are on steroids are going to be more prone to getting certain types of infection, because steroids affect your immune function. And this is partly why we don't just prescribe steroids to adults who've never had them before, because those adults are more frail compared with the adults who've been on steroids throughout their childhood. But certainly we had one patient who had recurrent abdominal pain. He went to his local emergency department. They kept telling him there's nothing wrong, go home. He came onto our ward and he was found to have an abscess in the abdomen. So, and that had to be drained. So these are all acute emergencies that are specific to Duchenne. What about limb and back pain? Well, the most common cause of pain that we see is due to poor seating. So you can get backache, particularly due to what we call the lordosis, the shape of the back, and tightness in the hips. And actually a good physiotherapy and occupational therapy assessment can often help to resolve some of these pain issues. But we do see patients who over time develop what we call subluxation or dislocation of the hips, and also inflammation in the sacroiliac joint. And we have a number of patients who've had this. And I've referred them to orthopedic surgeons, and their pain has been really helped massively by local injection. You heard from Dr. Wong that fractures occur more easily if you're on steroids, but also if you're an older person with Duchenne and you're not on steroids, your bones will be quite thin and will break easily. And sometimes they can just fracture when you're being hoisted, for example. So if you get an acute sudden pain, it's possible there might be a fracture and you need an X-ray. And, you know, we've had 2 patients now who've experienced gout. So one chap developed a very severe swollen and painful knee. He was actually treated for heart failure and had been on high dose diuretics for quite some time. He had an incredibly high urate level. It was over 1,000. And we've had to treat his gout by increasing his steroids and putting him on another drug called allopurinol. So this was a direct effect of the treatment for his cardiomyopathy. And finally, we've had a couple of patients who've had blood clots, deep vein thromboses. Now, this is very unusual. And if this occurs, you've really got to look for another cause. And that's what we found in our patients, because most people who are used to being in a wheelchair are not prone to getting blood clots. So if you get a swollen calf and a thrombosis, it needs to be investigated to rule out another cause. What about infections and coughs and colds? Well, I want to reassure you all that vaccines are very safe and they're really good at preventing infections, particularly the flu vaccine, the vaccine for pneumococcal infections, which is called Pneumovax, and COVID vaccine. The COVID-19 vaccine is safe for people with Duchenne. If you've had a chest infection, you've heard earlier, and you have a weak cough, use your cough augmentation and keep a supply of antibiotics at home. I always suggest to my patients, if they get a cold, start antibiotics anyway. So keep a supply at home, and you might need to use your BiPAP machine for more often than you normally do when you're unwell. It's also important to say, so a lot of people have been really scared about COVID-19, but we've had now, I think, more than 22 adult patients with Duchenne who've had COVID. We've not had any COVID related deaths. Almost all of the patients that we've seen who are on steroids or not on steroids who got COVID have very mild symptoms, and some of them just literally lost their sense of smell. There was one patient who required admission to hospital, and he was the only patient who did not have the vaccine. So the vaccine is really important in terms of keeping people well. I would also say that if you're unwell, particularly if you're on cardiac medications, which you should all be by your age, it's really important to avoid dehydration, because when you're unwell, you drink even less. And if you drink even less, you've got a higher risk of going into renal failure, which I mentioned earlier. But also that we now know that there's this new phenomenon called acute ketoacidosis that can occur in particularly adult Duchenne's who become unwell. So drink plenty of fluids. And if you can't eat, so if you're fasting because you're so unwell, have a glucose drink. Try and keep your glucose levels up. So something like Lucozade or a sports drink can be very helpful. Again, other symptoms we see quite often are palpitations and dizziness. So palpitations, well, panic attacks are quite common as well in our Duchenne population. So this goes back to the anxiety and phobias. Please, please do talk to your doctors if you have any of those symptoms. But sometimes palpitations can be due to the rhythm of the heart being erratic, as you've heard earlier. So contact your team, particularly your cardiologist, and they might arrange a 24-hour ECG and offer treatment if this is a cardiac dysrhythmia. And as I've mentioned, we've seen some quite severe episodes of anemia. Anemia can make you feel dizzy, particularly if you're sitting up from lying down, for example. So a regular blood test at least once a year is worth doing. And don't forget, you're getting older, so you might get other things. Thyroid conditions are common in the general population. And certainly we've had one patient with Duchenne with an overactive thyroid gland, which caused problems with cardiac palpitations. So we have to think laterally if things are a little unexpected. Headaches. Don't suffer in silence. So again, migraine headaches can occur in anyone, whether you've got Duchenne or not. But certainly if you have tight neck muscles, a contracture in the neck, that might make you more prone to getting migraine headaches. And there are lots of options to treat these headaches. So don't suffer in silence. But more importantly, again, if you're not using non-invasive ventilation, that's the BiPAP, morning headaches could be a sign that you need urgent help with your breathing. Do not delay. If you're waking up every morning with a headache, contact your team because they may need to do a sleep study and assess your breathing at nighttime. And what about visual problems? Well, again, I bet some of you will relate to this. I've spoken to patients of mine who have short-sightedness, and the problem is that glasses keep slipping down the nose. I have exactly the same problem. I have to keep pushing them back up. But if you can't push your glasses back up your nose, it's very frustrating because you can't get clear vision. And actually, I referred one of my patients to our local eye hospital, Moorfields Eye Hospital, and they did laser eye surgery for him, and he doesn't need to wear glasses anymore. And that was a huge success. And likewise, people who've been on steroids for many years, particularly deflazacort, will be prone to getting cataracts. And we've had several patients now have had cataract surgery quite uneventfully. So again, if you're on steroids, make sure you have your eyes checked at the optician at least every year. And if there are steroids, then treatment may be necessary. Another steroid side effect, which I've only seen once, and as I said, this is a very anecdotal talk, but these are the rare things occurring rarely in people with Duchenne, is a benign intracranial hypertension. And this is a side effect of steroids, and it's another reason for headaches occurring early in the morning on waking. So again, if you have headaches on waking, please contact your neuromuscular team. And of course, other things can happen. We had a patient with Duchenne who developed optic neuritis. This is not related to Duchenne dystrophy, but it did affect his vision. So again, if you have something that doesn't feel right, contact your team because it might not necessarily be Duchenne, but you need to have it investigated and assessed further. So just to summarize, this is a very rapid anecdotal stroll through my years of experience of a big cohort of adults with Duchenne. So this is just to summarize. I think it's really important, as we've heard, adults with Duchenne are healthier now than they've ever been. They're living longer than they've ever been. So adopt a healthy lifestyle to give yourself the best chance possible. Be proactive, be in charge of your condition, read about it, download the standards of care, and make sure you're seen regularly. Turn up for your appointments, and if you don't get an appointment, badger your team to send you one. If something doesn't feel right, it probably isn't right, contact your team. So if you have a symptom, it might be very non-specific, just don't feel right, contact your team. Make sure nothing else is going on. And when you're offered treatment, please take it. Don't worry. I know worries and anxieties can get in the way. Please, please take it. It's for your good. And don't think that because you have no symptoms that these medicines and BiPAP are not doing anything for you, because they are. We know they do a lot of good. So no symptoms doesn't mean everything is okay, because if you get symptoms, it's really too late. So take the treatment and keep well. And that's all I'm going to say.